Hi, I'm Andrea Contreras. I'm a third-year resident of obstetrics and gynecology in Texas, and so I get to take care of women's reproductive health and walk them through their pregnancies. The ability to provide abortion services in the country at this moment is something that I'm very proud of. It's something that I think is essential and necessary. The abortion bans that we're seeing, nationwide make it really difficult to provide care to women who are experiencing both miscarriages, who are experiencing any sort of bleeding in the first and second trimester, or women who are experiencing loss of wanted pregnancies. And so I think it really affects my ability to counsel patients regarding their medical diagnosis and treatment plan. So I really believe in a shared patient physician decision making process and going back and forth to figure out what's right for a patient. But I am very forward and open about the fact that these medications are safe, effective, but are also used with elective abortions, and that there's a lot of recent law changes and restrictions and bans that makes getting these medications a lot more difficult, and that there's a lot of bias with these medications, so that sometimes they might have difficulty picking up these medications in the pharmacy. The abortion laws in Texas and in the nation have added another layer of complexity to, dealing with early pregnancy loss or pre-proms or pre-labor premature rupture of membranes. There has been more extensive discussion regarding treatment options, particularly when the patients would like to proceed with termination, and would not have been such a point of contention prior to, Senate Bill 8 or the fall of Roe. I think the first time where I experienced this delay in care, it was very upsetting. I understand that there is a fear of, legal action, which is completely understandable and a completely human reaction. But for me, it was just so cut and dry as to what was right and what was acceptable, and delaying care for me was considered unacceptable. And we have, all of this data that shows that these medications are safe and effective. And I've given this medication to patients and I've counseled them that it's safe and effective. And so having a judge who has not had the same training that I've had, who I don't know if they've read the same studies that we have, if they've read our guiding, treatment articles, it's frustrating. It also assumes that I would give a medication that's unsafe to a patient when I've taken an oath to do no harm. And that is almost insulting to me and everybody in our profession.